urologist here with the Iowa Clinic, and I've been in practice since 2007 here. And I'm excited to be able to talk to you about enlarged prostate this evening. Can everyone hopefully hear me all right? But I do appreciate you joining me this evening. So what is enlarged prostate? That's one of the questions we're going to talk about. Also, what your prostate does, what is enlarged prostate, how is it diagnosed, and some of the options for how we take care of that. Prostate is a walnut-sized gland. It's at the base of the bladder, and it surrounds the urethra, kind of how a funnel works. And the purpose of the prostate is to produce fluid that helps with semen production and makes fluid for semen. Now, there are two phases as far as prostate growth. Prostates start from birth up through teenage years, and at that point, the prostate's about a normal size. And from there, the prostate will then continue to grow onto adulthood. But most of the symptoms do not, sorry about that. Hi, welcome. Thank you. Sorry. Do not start to show up until you're about in your 50s. So there are two phases for prostate growth, but prostate will be about normal size once you're in your 20s, and then from there, it will continue to grow. Get our next slide here. So other things that can affect your prostate relate to inflammation or infection of your prostate. This can affect your urination, enlarged prostate that we're going to talk about, as well as prostate cancer. Now, our talk is tonight will mostly be enlarged prostate. Any of these three conditions can affect your ability to urinate and how you urinate. But we're going to talk mostly about enlarged prostate. And for the most part, for prostate cancer, we catch that early enough that most men will not have really any symptoms of prostate cancer early on. Now, as men mature, they are going to have more symptoms of enlarged prostate. What these pie graphs show is how frequently men are affected. So in the orange is the number of men who end up being affected by enlarged prostate. Excuse me, sorry about that. We'll go back here. And as you can see, as men mature, they become much more symptomatic. So it's a very common condition. What is enlarged prostate? The medical term is benign prostatic hyperplasia. That can be a mouthful, so we use BPH. It's benign growth. It's not cancerous growth of the prostate that affects primarily the center portion of the prostate, that part that surrounds the urethra. And as it grows with time, it makes it harder for the bladder to work and causes changes with symptoms with urination. Because it relates to the prostate, there are other things that we can see, such as PSA. PSA can rise with both enlarged prostate and prostate cancer. PSA alone is not one of the diagnostic tools that we use for enlarged prostate, but it is a non-cancerous enlargement of the prostate. So here in this diagram, you can see on the left, a normal prostate, a normal bladder, and with time, which you'll see on the right, you're going to see the prostate start to enlarge. It's going to start to squeeze on the bladder, and that makes the bladder work harder. One of the misnomers is that when I see men in the office, they'll tell me, well, my prostate isn't large, but they're told by their family doc, you don't have a large prostate, but they have symptoms with affect urination. And so one of the misnomers is that size doesn't necessarily correlate with severity of symptoms. I can have men in my clinic who have very small prostates but are very symptomatic from their prostate, and men who have very large prostates but are not symptomatic from it. So size doesn't correlate directly with your symptoms. In this schematic, what we're seeing here is on, again, the left, a fairly normal bladder with a prostate and the urethra. You can see that prostate is kind of that donut that surrounds the base of the bladder. What happens with enlarged prostate over time, as it grows, it chokes off the bladder. It makes the bladder work a lot harder. That bladder muscle has to compensate. It compensates by trying to get stronger. But in doing so, that bladder muscle starts to get thicker. And when that bladder muscle gets thicker, it now gets stiffer. It won't relax like it's supposed to. And over time, that bladder muscle can start to fatigue. It can tire out and start to weaken. And that's when you start getting a lot of problems. So the trick really is to be able to intervene before you end up with permanent damage to the bladder. Here's some other schematics and other examples of enlarged prostate. Again, starting on the left side, working to the right. We see a normal prostate on the top row. The picture below is what I would typically see with a telescope looking inside of a man in our clinic. What we're seeing is through the prostate into where the bladder. And so that dark oval in the middle of the picture is going to be into the bladder. As you start to see in the middle column with enlargement, we're now starting to see two parts of the prostate kind of squeeze off and choke off the urine flow. And as you can see on the far right, enlarged prostate, which has really choked off the bladder. What are the signs and symptoms of enlarged prostate? And those all relate primarily to changes with the bladder and how that bladder has to adjust. Frequent urination, multiple trips, having to get up at night, the sudden urge to urinate, hard to postpone, weaker stream, slow, the start and stop. Those are all common signs of enlarged prostate. It's important to understand that because enlarged prostate ultimately affects quality of life, not only for the male patient, but also typically for their spouse, surprisingly. They may start avoiding traveling. They're going to have to start making lifestyle choices. Patients who have more significant symptoms will be able to tell me where every bathroom is in every store they go to because that's the first place they go to. So it interferes with leisure activities. It disrupts sleep. And if it disrupts sleep for the male patient, it's also typically going to disrupt sleep for the spouse. And so it affects quality of life not only for the patient, but also for their spouse. How do we diagnose enlarged prostate? Partly it's through the history, partly it's through our conversation as we talk about those symptoms. Other things from an exam standpoint, I like to use an ultrasound of the bladder. It tells me how much urine is left over. How well is that bladder emptying? I'll do a prostate exam. That kind of gives me a guesstimate for overall size, but I'm also kind of feeling more for lumps and bumps. So the prostate exam isn't the end all, but we also rely heavily on what's called the International Prostate Symptom Score or Symptom Index. It's a questionnaire, a validated questionnaire, which means that these questions that are specifically asked are asked for a purpose because it relates to severity of symptoms. We'll use other things, tests in the office, UroFlow, which tells us how quickly you can empty your bladder. We'll look at ultrasounds of the prostate to look at size and shape. This is also commonly done when I do prostate biopsies, looking for prostate cancer, and a telescope, or what's called a cystoscope. That's a direct visualization into the prostate to see how large the inside is. Let's talk about the symptom score, because we pay a lot of attention to this. And here are the questions that or the topics that talks about how commonly you feel like you're having trouble emptying your bladder, how frequently you're going, how urgently you're having to go to the bathroom. Are you having to strain? How many times at night are you getting up? And so those questions then tell me how severe your symptoms are. And that's important because that then helps me to determine course of treatment. There are 3 groupings based on your score. As you can see on the right-hand side of the screen, in the gray rectangle, a score of 0 to 7 is mild. In the light blue, 8 to 19 is moderate. And in the darker blue, 20 to 35 is severe. We'll get into that a little bit later. The orange box, quality of life score, 0 to 6, really just tells me how bothersome or how much of a nuisance these symptoms are to you. There's a subjective nature to how the questions are answered, but it's a good way to assess when I'm first seeing a patient and when we institute a treatment, whether it be medication or a procedure, that I can go back to and we can repeat and see how are your symptoms. Are they improving? Are they the same? Are they getting worse? So it's a way to grade and score the symptoms. What are our treatment options for enlarged prostate? Well, they range from least invasive to the most invasive, and it really depends on the patient. There's no one size fits all model. It really depends. Again, I'm going to go back to the symptom score. The symptom score really pays attention to your treatment options. If men are in the mild score, they really don't need treatment. They can be watched. Moderate, if this is kind of off the bat and this is the first time I'm seeing them, I know that those men will typically respond to medication. And men in the severe category are probably ultimately needing a procedure. If they're not on medication, we can try that first, but let's go on. So let's talk about the watchful waiting. This is primarily for men who have mild symptoms. There's no procedures, there's no surgeries, there's no side effects. So from that standpoint, men with very mild symptoms don't really need anything else done. You may have to adjust lifestyle. You're going to watch how much fluid you consume before bed. You're going to make sure you're urinating before you go to bed. You're going to watch your caffeine intake, your coffee intake, things like that that can affect your frequency of urination. And over time, your symptoms may worsen. And at that point, then we reevaluate. For men who typically have more moderate symptoms, we're going to look at medication. The medication I use the most is right here, called Flomax, or tamsulosin is the generic name. There are other medications, Avodart, finasteride, etc. But the purpose of medications is to help with managing those symptoms. They can help to provide relief. The downsides is that there are side effects to some of the medication, whether lightheadedness, dizziness, which is 10% of the time, retrograde ejaculation. They can sometimes have sexual side effects. Most of the medications, fortunately, are generic. So as far as cost, overall, pretty minimal. But over the years, you have to admit those costs do add up. One of the issues is that some medications can work fairly quickly. They can help within, a couple of weeks. Other medications take a long time, and you may not see significant improvement in your symptoms for at least 9 months or later. Herbal supplements, herbal remedies, advantages, they're not a drug. They're not approved by the FDA. So we don't really know how well they're going to work. So if you want to try them, you can. They may provide benefit, but we really don't know. Is it really going to hurt anything? Probably not. For men who have been on medication, who aren't getting the symptom relief they need, their symptoms are worse. Maybe they can't tolerate medications. Maybe they're having side effects. Then we'll look at a procedure, because we know ultimately procedures tend to work better than medication. So the next step in my treatment regime is UroLift. It's a procedure I do in the office. It allows men to have improvement with their urination symptoms, and they don't have the sexual side effects of other therapies, other surgeries, or medication. 2/3 of men will not need a catheter after the procedure, and it has good, durable results. We know at least 5 to 8 years and even some 10-year data coming out of Europe. Disadvantages: it can be uncomfortable. You're going to have stinging and burning for a couple weeks. You're going to have blood in the urine on and off for the first week or so. You'll have mild improvement with your symptoms for the first couple weeks, but it can take 2 to 4 weeks for a lot of those symptoms to improve, and sometimes even up to a couple months. And we'll get into that. For men who that doesn't work, there are thermal therapies. Those are heat therapies. An older one that we used to use was called cooled thermotherapy, or a microwave treatment, which was done in the office. A newer one is called Resume. It's a steam treatment for enlarged prostate. We currently do not do Resume at the Iowa clinic. There is some discomfort. They can usually be done in the office, but you're going to need to be catheterized, have a catheter for some time after the procedure, and it just does take a lot longer for your symptoms to improve. And then for men who nothing else is really working, then we do have our old standbys, whether green light laser photovaporization of the prostate, what we call a green light procedure, or the traditional TURP called transurethral resection of the prostate, sometimes given the more common term Roto-Rooter, but I don't really like that procedure. These have great results. They really improve urine flow, really help the bladder to work more efficiently. They are able to remove that prostate tissue, and they don't need to have a lot of retreatments, but they're done in the hospital. They're done under an anesthetic. The green light laser procedure, you can go home usually that same day with a catheter. For the TURP procedure, you may be in the hospital for a day or so. You're going to have, again, stinging and burning and blood in the urine, but they can affect erections, as you can see towards the bottom of the orange box. There is a potential for changes with erections, changes with ejaculation. Incontinence will vary to some, depending on study, 3% or sometimes even less than that. So the one that I like to use, which I even did today, a number of procedures in the office, was UroLift. And this was, I found very helpful for my patients. So the way this will work is a camera after a local anesthetic and numbing medicine applied around the prostate to keep the patient comfortable. A special camera is inserted into the urethra, the P-tube, and I'm watching this up into the prostate. Then a series of implants, or like staples, are then placed to literally pin back the walls of the prostate. Think of it like a curtain tie, how a curtain tie can hold your curtains back so you can look through the window. This will have a very similar effect. I sometimes use the analogy of a staple. We're going to staple and pin back the walls. But as you can see from the left picture, the enlarged prostate, and then the telescope, it's deployed 2 implants, and then the final picture, an example of 4 implants placed and how that works. Each implant is actually very small. It contains a nitinol tab, and this is secured on the outside of the prostate. There's a suture, which then braces between the nitinol tab and the urethral inpiece, and that's what I'm using the telescope to compress the prostate tissue. And then that little inpiece is applied. Over time, the lining of the prostate will grow over that stainless steel inpiece, and it will no longer be visible, but it'll continue to keep the prostate pulled back and pinned back. We'll see if this works. This is a schematic of, or an animation of how the procedure goes. So here's the telescope. It's pushing the prostate, it's deploying the implant, and there the inpiece is applied. So on the reverse, I compress, push on the prostate. I'm going to deploy the inpiece. There's this filament is the green, and then the tab. And so kind of a schematic before and after computer rendering. Actual pictures, not mine, but from other physicians who have done this procedure, to show the pre and the post, the before, how the urethra, how the prostate had pinched the bladder shut, and afterwards how that prostate had been nicely opened, and now you can see a nice clear channel into the bladder to improve urine flow. So what can I expect after having the procedure? Well, I tell my patients that unfortunately, because of the nature of the procedure, you are going to have some stinging and burning and some blood in the urine for at least the first week or so. And you may not like me very much right after that procedure for that first few days, but that will all pass. So burning with urination, blood in the urine, discomfort in the prostate area, all very common. Urgency of urination, frequency of urination, getting up at night, that takes longer to calm down. You're going to see mild improvement for the first couple weeks. It can take a couple months to see the full benefit. Why is that? Well, for the first part, I've irritated the prostate with the procedure. So you're going to have some time for that inflammation to subside, and that's going to take the first week or two. From there, once the prostate's opened up, that bladder now has to go through an adjustment phase. If I'm going to scroll back here, so bear with me. We're going to go all the way back to the beginning of the presentation. Remember that bladder that had been working hard for a long period of time. That muscle has had to compensate. It's trying to get stronger. It's thicker. It's stiffer. It doesn't relax. Once that prostate is opened up with the UroLift, that bladder has to adjust to not having to work so hard. And that is what takes several months for that bladder to do. And so that's why men don't necessarily see an immediate improvement with their symptoms, but they will over time. And we do know that it is durable for over definitely 5 years. This is recognized by Medicare. Most non-Medicare plans will cover UroLift. Depending on the plan, there's a number of hoops they may ask me to jump through. But we haven't really had too many issues with that. Will it help most people? And this is a very good point. Overall, the UroLift is effective about 90% of the time. That means 10% of patients will not get significant improvement with their symptoms. It also depends on how severe their symptoms are. We're going to go back, just bear with me. We're going to scroll back. to where we talked about this symptom score. This is why I use this. I'm going to assess your symptoms when we see you. And depending on mild, moderate to severe, we're going to talk about treatment options. Men have to have a symptom score of at least 8 to qualify for having a UroLift. In my practice, what I've noticed is that men who have severe symptoms have the most to gain by having a procedure done. So when they're in the severe category and they have a procedure, usually when I'm seeing them back, we can get them into the low, moderate, or maybe even mild category. The men who typically have moderate symptoms, now granted, that's still a pretty big area between 8 to 19 for their score. But men who tend to be in the middle or on the bottom end of that moderate category just don't have as much room to improve. So, and I counsel men, that's important for them to recognize what is a realistic expectation for what they're going to be like when they're after the procedure. So men in the moderate category, low moderate, I can probably get them off of their medication. Their symptom score may not change dramatically, but if we are able to maintain that without medication, in my book, that's still going to be a win. And again, men in the mild category don't need a procedure done. As an example, here's kind of some of my data just kind of in closing. One of the pivotal clinical trials looking at the UroLift system was called the LIFT study. And this was an international study. Every patient received 4 implants and they monitored their symptoms. And so there are 2 lines. The orange line is what was the study data for where their symptoms started. So on the left-hand side, the vertical is the severity of their symptom score. And that, as you can see, goes from 0, they went up to 25. So, and then in my data, which is the blue line, we started off about the same. Average score was 22. And as you can see, in the 2 weeks, we dropped. And in the 1 month, we continued to drop. And then the 3 months, we continued to drop. And then my patients, by 6 months, continued to have improvement, whereas in the study, the international study, those patients' symptoms remained stagnant. Well, the reason I can account for that is I wasn't held necessarily to using 4 implants, which the study did. So it shows that patients will get good improvement with their symptoms. So at that point, I'll turn this back over to Kylie. We did get some questions emailed in already, and I'm going to try to go through some of those. It's common to get questions concerning prostate cancer, which unfortunately is a little bit out of the scope of our goal for tonight for talking about enlarged prostate. But one of the questions related to, of the treatments available, which one gives the best outcome for a near quality of life? Again, that's going to depend on the severity of your symptoms. It's going to depend on what procedures you may have had before. But typically, if you can qualify for a UroLift, that will have durable improvement with your symptoms for enlarged prostate, not affect erections, not make erections worse, not contribute to retrograde ejaculation. Different treatment options for difficulty urinating. I think that was another question. We kind of talked about those different treatment options related to in men with mild symptoms, watching, observation, moderate symptoms, starting with medication. If medication works, great. If not, looking at UroLift and then moving from there. Another question was other treatments for enlarged prostate, and the ones they asked about were cryosurgery, UroLift, and HoLUP. So HoLUP stands for Holmium Laser Enucleation of the prostate. This is a different type of laser procedure in the operating room for cleaning out or coring out the inside of the prostate. That's a procedure I do not do, but I was trained in residency to do that. I have elected not to do that. I use the green light laser or the traditional TURP instead. UroLift, we talked about. Cryosurgery is a freezing of the prostate, which is used for prostate cancer treatment. So it can treat enlarged prostate symptoms, but is reserved primarily as a prostate cancer treatment. Another question is, what is Resume steam treatment? This is a thermal therapy, so this is a heat treatment procedure which can be used in the office to help men who have enlarged prostate symptoms, where in a very controlled fashion with a telescope, steam can be carefully injected into the prostate. Whereas I'm using a UroLift, I'm using special staples to pin the walls back inside those lobes. Then steam can be injected, and that will cause ultimately the inside of the prostate to shrink away and open up a channel. Another question is, what's the preferred treatment that the Iowa Clinic uses? And that would be UroLift. And the other question was, are there any new treatments that show some promising results? And right now, for in the office, it's primarily either UroLift, or other parts of the country prefer Resume. It's really just kind of dependent on the physician, on the urologist. I trained with UroLift, and in my practice, my patients have had good results, so that's what I primarily stick with. So I'll turn it back over to Kylie and see if we have any other questions.
Thank you, Dr. Meyer. We do have one additional question, and just a reminder, if anyone has additional questions, you can submit them through the little Q&A feature down below. The question is, if one has already had laser surgery, is UroLift still a viable option?
I would say it depends. So, and I've used this also for some of my patients. So more often than not, yes. With either laser surgery, for example, the green light, another laser that's used sometimes for prostate is called a Holmium laser. It's not uncommon that over time you will get enlargement of the prostate again. The prostate tissue will, with time, grow back. Over time, their symptoms can return as it relates to getting up at night, weaker stream, maybe more frequent urination, more urgency of urination. At that point, if that happens, I look at a repeat scope procedure in the office to see where the issue is, because it might not always be enlarged prostate. Depending on the laser procedure, sometimes it can be scar tissue in the urethra due to inflammation, and that can mimic enlarged prostate. Sometimes, unfortunately, it can be scar tissue where the bladder and the prostate join. And that needs to be evaluated because that's handled differently. But because of those narrowings, it makes the bladder work harder, and the symptoms are very similar to enlarged prostate. So if those aren't present, and we would know that when we look in, and if there is enlargement, then sometimes I can treat that with a UroLift. A gentleman I just took care of today had the TURP done several years ago in another state, and it worked fine for him for several years, but his symptoms returned. And so we treated him today very successfully with a UroLift procedure. I think it went beautifully. So time will tell as far as how his urination improves, and we'll see over the next several weeks and months as we have them back in the office for follow-up. So a long answer to a great question. It does depend, but more often than not, yes.
One additional question that came in: how long does the UroLift procedure take in office?
I'm going to again answer, the actual procedure itself is probably about 10 minutes. That being said, when it's scheduled, I schedule for an hour, and we usually like to have the individual there about 20 minutes prior to their scheduled time, or even a half hour prior to their scheduled time. And that's because there's time to check in. We check the urine sample, make sure no signs of active infection, make sure if they've been needing to be on antibiotics prior, that that's done. If they're on blood thinners, that they were stopped at an appropriate time. We're going to use numbing medicine inside the urethra, lidocaine jelly. We want that to sit in there for a while. And then I'll do what's called a prostate block. It's similar to how a dentist may use Novocaine to numb up your jaw. With an ultrasound machine, I'm going to deaden nerves for the prostate to help my patients remain comfortable during the procedure. And so all that takes time. The actual procedure itself is probably 10 to 15 minutes. Once that's complete, we leave the patient with some water in their bladder so they can try to urinate. We want to make sure they're able to empty their bladder well before they leave our office. In case they happen to be in that 1/3 group that needs a catheter, 2/3 of men will not, but every once in a while there are men who will need a catheter, so we want to make sure we can intervene and catch those. And then from there, we'll review instructions, some do's and don'ts, some what to expect, when to contact us. So overall, it may take about an hour, hour and a half in our office from door to door, but the actual procedure is about 10 to 15 minutes.
Perfect. And if someone wants to come in and see you, Dr. Meyer, to talk about UroLift or BPH or any of the topics we discussed today, what's going to be their best bet for next steps?
Well, their next steps, we would ask them to contact our office, which can be done several different ways. They can call and request an appointment. They can try to schedule online using our patient portal, our Follow My Health patient portal. But they would need to contact our office to ask for a visit so they can schedule an appointment with me so that we can review your medical history, review your symptom score, see how you're emptying urine sample, and then proceed from there.
Great. And we will be sending out to all of you who have watched the webinar today, we will be sending out a follow-up email with some of the worksheets that Dr. Meyer referenced today, and that will come after this. So if there are no further questions, thank you, Dr. Meyer, for your time, and I encourage everyone to reach out to Dr. Meyer through his office. You can find that on iowaclinic.com, the number there, and I encourage anyone who has further questions to reach out. Thank you so much, everyone. Have a great evening.
Great. Thank you, everyone. Have a good day.
Thank you, Dr. Meyer.
Thank you, Kylie.